Good afternoon, fellow HCA students. My name is Zachary Harrison, and today we are going to be exploring three relationships in the healthcare industry that utilize effective communication and the benefits of using effective communication. To begin with, a little bit about my background. I am a former CNA, and maybe in the future I will be again. But in my time on the ward, I saw many instances of both effective communication and ineffective communication, instances where things occurred that were could have been solved if someone just spoke up or talked. So let's get to it. All right, now let's look at some relationships with between a physician and a patient. Now, when our patients get sick, it's just as important for us to listen to them and educate them as to treat their illness. Education and dialogue can reduce stress, and indeed, this is the case, as the more that a patient is informed of what is going on with their condition, the more they are likely to continue to not only see this physician, but trust the healthcare industry as a whole. Another thing is with effective communication between a patient and a physician. Say if a patient is supposed to be on a particular medication, and in this case, the patient just ceases their dosage. Um, in this case, the patient would have to relegate that information to the physician for the physician to be able to make a determination of whether or not they should move forward with discontinuing the medication altogether or maybe changing the dosage or what have you. Now let's look at another relationship between staff and the patient. In this relationship, the patients have responsibility to be open and honest, just as they would with a physician, about the reason for their visit, their history, lifestyle habits, and any concerns or questions that they may have, because as healthcare professionals, we just don't know, right? So it's imperative that a patient be open and honest about anything that might be occurring or something they may left out, even if they think it's minute or unimportant. Let's look at between physicians and caregivers or family members, for instance. For many patients, it is crucial to include non-medical caregivers and family in the information loop. For instance, if, say, there's a resident on a extended living facility, their families or their caregivers would become their powers of attorney, or their main advisees about what they should do. And so it is very important that the doctors and the nurses and the CNAs on the facility work together as a unit to make sure that the resident has the most excellent, the most exemplary care that they could possibly have, and that all their needs are being met. And if that means having a particular CNA be designated to take care of that resident, sometimes that is the case. Elderly patients with visual or hearing impairments, those with language or cultural barriers need to have translators, or they need to have people who are on their side who understand their cultural needs in order to for the staff and the physicians to be able to understand about what kind of care that they want in particular, because it is all up to them. And in the end, that is what healthcare is all about, is serving the patient and the resident as efficiently and as exemplarily as possible. So, in conclusion, this has been my submission for the relationships that exist in the healthcare association. Now, there are many, many, many more that we can go over later. But for now, that is all. Thank you.